All right, get ready, because today we're diving deep into the world of oxygenation and perfusion.
Yeah, it's going to be a fascinating journey as we uncover how the respiratory and cardiovascular systems work together. It sounds complex, I know.
It can be, but we're here to break it down into those need-to-know pieces, especially for you future nurses out there.
Exactly, because understanding these systems is so crucial. It's the foundation of so much of what you'll do in your nursing practice.
And to make it all come to life, we'll use some real-world cases to illustrate how all this physiology plays out at the bedside.
And I think we might even surprise you with a few things, like why something as simple as turning a patient onto their stomach can sometimes dramatically improve their oxygen levels.
Okay, I'm intrigued. Let's start with those real-world cases you mentioned. What kind of patients are we talking about?
All right, so picture this. We have 12-year-old Tyrone. He's come into the ER experiencing an acute asthma attack.
Oh, that's a situation every nurse will likely encounter at some point.
Right. And then we have 57-year-old Jan, who's recovering from pulmonary surgery and is currently on a ventilator.
Two very different patients, but both facing challenges to oxygenation and perfusion.
Exactly. And these cases highlight the wide range of situations you'll encounter as nurses. So let's start with the basics. Let's break down the respiratory system.
Okay, the respiratory systems, it's all about breathing, right?
Yeah. Think of it as a beautifully designed pathway for air to travel from the outside world all the way down to those tiny air sacs in your lungs, the alveoli.
So the air enters through the nose and mouth, travels down the trachea.
Right, and the trachea then branches into the bronchi. You've got one bronchus leading to each lung, and then those bronchi branch out even further, getting smaller and smaller.
Like the branches of a tree.
Perfect analogy. And ultimately, those tiny branches lead to the alveoli, those little air sacs.
Yeah.
Those alveoli, they're surrounded by a network of capillaries.
Capillaries, those are the smallest of our blood vessels, right?
Exactly. So picture this. You take a breath, and that oxygen-rich air makes its way down to the alveoli. And right next door are the capillaries, just waiting to pick up that oxygen.
It's like a busy intersection where oxygen and blood come together.
That's a great way to think about it. And at that intersection, the magic happens.
Okay, I'm listening. Tell me about the magic.
It's all about diffusion. Oxygen moves from the alveoli, where it's more concentrated, into the capillaries, where it's less concentrated.
So it's like those freshly baked cookies you can smell throughout the house, even if you're nowhere near the kitchen.
Exactly. The scent spreads from where it's strongest to where it's weaker. That's diffusion in action.
Wow, it's amazing how our bodies work, isn't it?
It really is. But there's another important part of the respiratory system we need to talk about. It's called the pleural space.
The pleural space. Okay, remind me what that is.
So imagine a thin sac surrounding each lung, and it's filled with a small amount of fluid. This fluid acts like a lubricant.
A lubricant. Why do we need a lubricant in our lungs?
It allows those lungs to expand and contract smoothly with each breath. Without that fluid, things would get pretty sticky.
Oh, I see. So for Jan, who's recovering from surgery, this pleural space could be really important.
Right, exactly. After surgery, there's a risk of inflammation and fluid buildup in that space.
Which could make it hard for him to breathe.
You got it. It's all about connecting those dots between anatomy, physiology, and what we're seeing with our patients. Okay, now let's quickly clarify two important terms: pulmonary ventilation and respiration.
All right, lay it on me. What's the difference?
Pulmonary ventilation is the act of breathing. It's the mechanical process of moving air in and out.
Okay, so it's like those bellows you use to keep a fire going.
Perfect analogy. Now, respiration, that's the actual exchange of gases, the oxygen going in, the carbon dioxide going out.
Okay, so respiration is where the real action happens.
Exactly. And that action is crucial for getting oxygen to every single cell in the body. But the respiratory system can't do it alone. It needs a partner in crime, the cardiovascular system.
All right, time to bring in the heart. It's the engine that keeps that oxygen-rich blood flowing.
And what an engine it is. Picture it as a muscular fist nestled right between your lungs.
And it's divided into those four chambers, right? The atria and the ventricles.
You got it. Those atria, they're like the receiving chambers, taking in blood from the body and lungs.
And the ventricles are the powerhouses. They pump the blood out to the lungs and then to the rest of the body.
Exactly. It's a perfectly coordinated system. So, deoxygenated blood from the body enters the right atrium, flows down to the right ventricle, which pumps it to the lungs to pick up fresh oxygen.
And then that oxygen-rich blood returns to the heart, goes into the left atrium, down to the left ventricle, and from there, it's pumped out to the body through the aorta. It's like a beautifully choreographed dance.
It really is. And those valves you mentioned, They make sure the blood flows in the right direction, preventing any backflow.
They're like traffic signals for the blood.
Love that analogy. But we can't forget those tiny capillaries. They're where the real magic happens.
The capillaries, they're like the delivery trucks, taking oxygen and nutrients to every single cell.
Precisely. And that process of delivering blood to those capillaries, that's perfusion.
Okay, so if we think back to Tyrone, who's having an asthma attack, his airways are constricted, which makes it hard to get enough oxygen to his lungs.
Exactly. And that means less oxygen is available to diffuse into his bloodstream, which can lead to hypoxia.
Hypoxia. That's when the body cells aren't getting enough oxygen.
Right. That's why he's struggling to breathe, why his heart is racing, and why he's feeling anxious.
His body's basically sounding the alarm. It's trying to get more oxygen.
Exactly. And as nurses, it's our job to recognize those signs, understand what's happening physiologically, and intervene quickly and effectively.
This is where things get really interesting. What kind of interventions are we talking about here? So many ways to help. What can we do to support these patients? You know, those who are struggling to breathe or whose hearts aren't pumping as well as they should.
Well, that's where our nursing skills come in, right? And it's not always about rushing to put someone on oxygen. Sometimes there are other things we can do first.
Like encouraging healthy lifestyle choices.
Right, yeah.
Those can make a big difference in the long run.
Absolutely. Things like helping patients quit smoking. We know that smoking has a huge impact on both the lungs and the heart.
And don't forget about vaccinations. They can help prevent respiratory infections that can really set some patients back.
Oh, for sure. Vaccinations are key. And sometimes it's about helping patients manage stress and anxiety.
Because we know that when people are stressed, their breathing can get all out of whack.
Exactly. It's all connected. Now, let's not forget those hands-on interventions. Things like deep breathing exercises.
Yeah, those can be super helpful. And what about incentive spirometry?
Another great one, it helps patients take those nice deep breaths and really expand their lungs. Sometimes it's the simple things that make a difference.
Speaking of simple things, you mentioned earlier that turning a patient onto their stomach can sometimes help. I have to admit, that sounds a little strange to me. Why would that help someone breathe better?
I know, it seems counterintuitive, right? But for some patients, especially those with certain lung conditions, lying on their stomach or what we call prone positioning can really help.
Okay, so how does that work exactly?
Well, think about it. When someone's lying on their back, the weight of their belly can push down on the diaphragm, and that can make it harder for the lungs to fully expand.
Oh, I see what you mean. So flipping them onto their stomach takes the pressure off.
Exactly. It gives the lungs more room to breathe, especially those lower parts of the lungs.
It's like giving those lungs a bit of a stretch.
I like that. And, it's been shown to be helpful in a variety of situations, from acute respiratory distress syndrome to, even severe cases of COVID-19 in some patients.
Wow, that's amazing. Sometimes the simplest things are the most effective. And what about hydration? How important is that for respiratory health?
Oh, hydration is huge. Staying well hydrated helps keep those respiratory secretions thin and flowing.
So it's easier to cough up all that mucus.
Exactly. Think about it. Thick, sticky mucus. It's like trying to breathe through a straw. It's not going to work very well.
Right. It can really clog things up. And sometimes we even use humidified air, right? Especially for patients on oxygen.
Yes. That's important because oxygen therapy can dry out the airways, so adding humidity can help loosen those secretions and make breathing more comfortable.
It sounds like we have a whole toolbox of interventions, right? It's not always about just treating the disease. It's about supporting the body's natural ability to breathe and function.
Exactly. We're helping the body do what it needs to do. And of course, sometimes we need to bring in medications to help things along.
Okay, time to talk meds. There's a whole world of respiratory medications out there. Where do we even begin?
Well, it's helpful to think about the different categories, right? We have those bronchodilators, which, as the name suggests, help to open up those airways.
So for someone like Tyrone who has asthma and whose airways are constricted, those would be key, right?
Absolutely. Bronchodilators work by relaxing the muscles around the airways, making it easier to breathe. It's like that moment when you can finally take a deep breath.
I can almost feel it. What other types of medications are there?
Well, we also have mucolytic agents. Think of them as mucus busters.
Okay, I like that. Tell me more.
They help break down that thick mucus, making it easier to cough up. So if you have a patient with, one of those rattling, productive coughs.
Mucolytics to the rescue.
You got it. And then, of course, we have corticosteroids. These are all about reducing inflammation in the airways. Really important for those with chronic conditions like asthma or COPD.
So we have medications that open up the airways, break down mucus, and reduce inflammation.
It's like a multi-pronged approach, right? Now, another important thing to consider is how these medications are given.
Well, a lot of patients use inhalers, right? Those
Yeah.
little handheld devices.
Yeah, inhalation is a common route because it delivers the medication directly to the lungs where it's needed most.
Makes sense. Are there different types of inhalers?
There are actually. You've got your meter dose inhalers, dry powder inhalers, nebulizers.
So many choices. How do we know which one to use?
It really depends on the individual patient, what they're comfortable with, what their specific needs are. And of course, it's up to us to teach them how to use their inhalers correctly.
Because if they don't use them right, the medication won't get to where it needs to go.
Exactly. And that defeats the whole purpose, right? So patient education is key. Okay, so we've talked about helping the body breathe better through, positioning, hydration, humidification, and medications. But what about those situations where someone's just not getting enough oxygen on their own? That's where oxygen therapy comes in.
Oxygen, it's like a lifeline in those situations.
It really is. We use oxygen therapy when a patient's blood oxygen level is too low.
Okay, so it's basically giving the body an extra boost of oxygen when it can't get enough on its own.
Exactly. And the goal, well, it's to increase the amount of oxygen in the blood so it can get to those cells that need it most.
So how do we give oxygen? I mean, are there different ways to do it?
There are. The most common way is through a nasal cannula. You know those little prongs that fit in the nostrils? It's a really simple and comfortable way to deliver oxygen, especially at lower flows.
Right. And then there are those masks, too.
Yes, those masks are typically used when higher flows of oxygen are needed or when we need to deliver a more precise concentration. The choice really just depends on what the patient needs.
Okay, that makes sense. Now, I have a confession to make. I always thought of oxygen as being completely harmless. But I remember you mentioning earlier that even oxygen can have side effects. That surprised me.
It's a good reminder that even with something as essential as oxygen, we have to be careful. Too much oxygen, especially in those with certain lung conditions like COPD, can actually be harmful.
Wow, I had no idea. So we have to monitor our patients closely when they're on oxygen, right?
Absolutely. We need to make sure they're getting enough, but not too much. It's all about finding that sweet spot. Now, shifting gears a bit, what about those emergency situations? When someone's heart stops beating.
Oh gosh, yes. That's when CPR comes in. Every nurse needs to know CPR.
It's absolutely essential. It's what we do when someone goes into cardiac arrest.
So it's about keeping that blood flowing, especially to the brain, until we can get the heart beating again.
Exactly. And we do that with chest compressions, which manually pump the heart, and rescue breaths, which provide oxygen.
And then there are those incredible AEDs. They seem so high-tech.
Those AEDs, those automated external defibrillators, can literally be lifesavers. They analyze the heart's rhythm and deliver a shock if needed. Sometimes that's all it takes to restart the heart.
It's amazing how technology can make such a difference in those critical moments.
It really is. But even in the midst of all that, we have to remember to protect ourselves too.
Right. Safety first.
Yeah.
We always wear gloves and use barrier devices during CPR. We can't help our patients if we get sick ourselves.
Exactly. Our safety is paramount. Wow, we've covered a lot of ground here, from anatomy and physiology to all those nursing interventions.
It's really amazing how much nurses do to support these vital processes, these, processes of oxygenation and perfusion.
It's the foundation of so much of what we do. It's all connected.
So if you're out there listening and you're a future nurse, what can you take away from all of this? How can you use this knowledge to be the best nurse you can be?
It all comes down to this. As nurses, you're like the guardians of oxygenation and perfusion. You'll be the ones right there with the patients, assessing them, noticing those subtle changes, like changes in their breathing or their color, their vital signs, those early warning signs. You got to be on the lookout.
So we got to be like those oxygenation and perfusion detectives, always looking for those clues.
Exactly. Think back to Tyrone, with his asthma. Recognizing those signs of hypoxia, like his breathing getting faster, or maybe he's getting anxious, maybe even a bluish tint to his lips or fingers. You spot those things. You intervene quickly. Maybe you give him his inhaler or you adjust his oxygen. Maybe you got to call the doctor. But you're quick. Your actions make a difference, a big one.
And for Yanan, recovering from surgery, he's going to be vulnerable. We got to monitor his heart function closely, watch for any signs of fluid in his lungs, and just make sure he's comfortable and supported. That'll help him recover faster.
It all comes back to what we talked about before, taking what you know about anatomy and physiology and those nursing interventions and applying it to each patient. Every patient's different. You got to see the whole picture and you got to advocate for them.
It's almost like you're learning a whole new language, the language of oxygenation and perfusion. You start to see those connections that cause an effect,
Yes.
and how what you do actually makes a difference to those processes, those vital processes.
Yeah, that's a great way to put it. Like learning any language, it takes practice. The more you practice those assessment skills, the better you'll get at spotting those tiny little clues, those subtle signs that something's not quite right.
So ask questions, listen to your patients, trust your gut, and never stop learning.
Couldn't agree more. Nursing is a journey, a lifelong journey of learning. And if you're ever unsure, don't be afraid to ask for help. Reach out to those more experienced nurses or other members of the healthcare team. We're a team.
That's such great advice.
Yeah.
This has been an amazing deep dive. I feel like I have a much better grasp on how those two systems, the respiratory and cardiovascular systems, work together, and the crucial role nurses play in keeping them running smoothly.
I'm so glad to hear that. But our exploration doesn't have to end here. There's always more to learn, more to discover.
Right. The world of oxygenation and perfusion is huge. There are so many specific conditions and treatments to dive into. I mean, if you're interested, keep learning. Do some research. Maybe look into the latest guidelines for managing asthma or the different types of heart failure.
And don't forget about all the amazing advances in respiratory care technology. New devices, new techniques, they're coming out all the time. It's an exciting field to be a part of.
So true. So keep learning, keep those questions coming, keep advocating for your patients. You have the power to make a real difference in their lives.
Well said. Remember, you're those oxygenation and perfusion champions. Go out there and make us proud.
Thanks for joining us for this incredible deep dive. We hope you found it informative and, dare I say, maybe even a little bit exciting.
Until next time, breathe easy and keep those hearts pumping.
See you on our next deep dive.